lady who was found to have a fundus less than dates, and we thought there is a fetal growth restriction or a small for gestational age baby. Her dates were confirmed at an early scan, so she's 37 weeks today. So same principle, we look for the lower pole and then we get the head and then we measure the head circumference and the biparietal diameter. Then we move up to get the abdominal circumference. Comes to about 28, compatible to 28 weeks, and the femur length, which comes to about 32 centimeters. And we also look at the Leica volume. Lower right. So in her case, Leica volume comes up to about 7 centimeters, which is marginal. Despite our clinical assessment of adequate LICO, and that is quite well documented that our clinical assessment of LICO is not so accurate. And that's the umbilical artery Doppler, and she has a diastolic flow, and she's 37. Now we are thinking of delivering the baby. The placenta is in the fundal area. So our presentation of cephalic presentation, that's the back and that's the breech. All that is, we managed to get it right, and the fetus is small. LICO is also reduced.
Let's briefly go through the important anatomical details useful in fetal ultrasound scan. Crown rump length. This crown rump length is important to estimate the gestational age in early pregnancy. This is done from the highest most position of the head to the lowest most position of the back. This is what we call as a crown rump length. Head circumference. Head circumference is done after 13 weeks of pregnancy, where in the transverse section we measure the circumference of the head. Biparatal diameter. Biparatal diameter, we will take the maximum distance between the two parietal bones. Abdominal circumference. In the abdominal circumference, we take in the transverse section, in the ultrasound scan, we take the circumference of the abdomen. This is important in the late pregnancy just to assess the fetal size and the weight rather than the fetal age. Femur length. It is another important measurement we will take from the hip joint to the knee joint to assess the fetal growth. Let's have a look at the structure of the umbilical cord. The umbilical cord is covered by the umbilical epithelium. Inside the umbilical cord, we have the connective tissue. Let's have a look at the umbilical cord. The umbilical cord is covered by the umbilical epithelium. Inside the umbilical cord, we have the connective tissue called Wathen's jelly. Embedded in the Wathen's jelly, we have a single umbilical veil and then two umbilical arteries. Also, we have the residual allantois also embedded in this Watten's jelly. This Watten's jelly is purely a gelatinous connective tissue which composed of extracellular matrix abundant in glycosaminoglycan, mostly the hyaluronic acid, collagen fibers, and then myofibroblast. Occasionally, we will have mast cells. The stromal cells in the Watten's jelly is highly abundant in the perivascular Watten's jelly region. It is less abundant in the intravascular Watten's jelly, and it is least abundant around the subamniotic Watten's jelly. It is important to remember this umbilical vein and the arteries do not contain tunica adventitia. Thank you.